My name's Olivia Buttterworth. I'm the policy lead for volunteering, voluntary sector and big society. So, very briefly, we've introduced this legislation that will create the NHS Commissioning Board. At the moment, at national level, there is no national level commissioning organisation that does any of that. So this legislation will create a national NHS commissioning board that will authorise and support local clinical commissioning groups. Those clinical commissioning groups will bring together health professionals and social care professionals and communities into a group that will commission services on behalf of local populations. What they will actually look like in practice will be different in every area. They will also look probably quite different to those groups that you see emerging now. So there are Pathfinder, they were called GP consortia, they're now called Pathfinder Clinical Commissioning Groups. There's an awful lot of them. Some of them are very tiny, some of them are very quite big. They will look very different by the time they go through the authorisation process. And if you've got time and the will and the inclination, the department's published a number of documents about the authorisation processes and the requirements for clinical commissioning groups. In all of that is a requirement for them to pay due regard to their local communities, and that's very much where volunteering projects particularly fit in. The bill also proposes the creation of something called Public Health England. So Public Health England will be something at national level. It will support the health of the public and do the national resilience stuff. So things like coordinating national flu campaigns and health protection work, and taking a national perspective about some of the big public health challenges that we face. Locally, public health will move into local authorities. Some might say back to local authorities because it's been there before. So at the moment, directors of public health sit in PCTs. They will now move and they will sit within the local authority. They will have a ring-fenced public health budget which will be there to commission specific public health services. But the Clinical Commissioning Group and the NHS Commissioning Board will also continue to have a responsibility for that public health activity that sits within the NHS. And they very much come together in the creation of health and wellbeing boards, which the Minister mentioned are the responsibility of the local authority, but bring together clinical commissioning groups, public health, and all of the other services and support locally that are about health and wellbeing in its broadest context. And we've had a question already about the voluntary sector's role not being mandated on there. It's been hotly debated. And what we know from some of the early adopter health and wellbeing boards is those that are progressing really well have a very mature dialogue and involvement with their local voluntary sector. The difficulty with mandating something that's voluntary is you can't mandate that which is voluntary. So you can't set out, you must involve a voluntary organisation because they're voluntary, they don't have to do it. So there's a bit of a dilemma, but we take the points that you need to be involved. And we can come back, we can talk about that as well, about how people are starting to get involved. The Health and Wellbeing Board will be responsible for a joint health and wellbeing strategy. That health and wellbeing strategy will be about the whole population, not the registered list of GP populations. It will be the whole population of a local area. They'll be responsible for doing joint strategic needs assessments. I ask this every time I speak. Who's heard of joint strategic needs assessment? That's the best response I've ever had. Who's contributed to a joint health? Fantastic. Wow, I was in Birmingham about 3 weeks ago and 2 people put their hands up in an audience of about 200. I'm astonished, that's great. They're really important, and again, in terms of the data and the evidence, and the experience that you have feeding it in, particularly for the most disadvantaged, the most vulnerable, those who don't access state services, therefore the state has little evidence about their needs. You need to be feeding that through, and you need a way of doing that, which is where the Health and Wellbeing Board is critically important. And we'll create Health Watch England. So locally, at the moment, we have local involvement networks, and they've had no national body. Health Watch England is meant to be the consumer champion for health and care. It's meant to be a consumer voice that's a powerful voice at national level that will sit with the Care Quality Commission, and it will also support and provide leadership to independent local health watches. So local health watches will, it's the responsibility of the local authority to ensure that a local health watch exists. We want them to build on the best of local involvement networks, but they also have lots of additional responsibilities that they'll be responsible for carrying out. Oh, it's done this mad thing. That's the clearest picture I think I've seen so far, which is why I've used it. I've seen lots of different pictures of what the new world looks like, and that's the most straightforward. I don't think it has everything on it, but I think from my perspective, being a bearer of simple things, that's the clearest thing. And the significant thing I want to point out is that the Department of Health has this kind of system oversight over this whole new world. In the same way that locally, the local authority, through the Health and Wellbeing Board, has that system oversight at local level. And I think that's really important to recognise that they're the two roles they play. So I think it's also very important, and I think this is reflected back about some of the issues around funding, is that it's not national government's responsibility to fund local services or to decide what's funded locally. It's the responsibility of local commissioners to understand how their local system's working and therefore how it needs to be resourced. So use that if it's useful. I'm sure it'll change a bit more as we go through the legislative process. When the legislation was introduced, people had a few concerns, and you might have noticed quite a lot of media coverage about different aspects of the bill. The Prime Minister and the Deputy Prime Minister asked Professor Sir Steve Field, I've just given him an extra title, Professor Steve Field, who's a GP from Birmingham, to chair something called the NHS Future Forum. And the Future Forum was a group of about 50 people that brought together clinical, citizen and public perspectives to inform the bill, to inform the wider reform programme. And they went out and they conducted a massive number of different listening exercises, which then fed into some quite significant reforms being made and amendments being made to the bill that's just gone through the Lords, in the Lords at the moment, sorry. They've asked now for the Future Forum to continue. They've had a few new people introduced to that forum, and phase 2 is going to look at 4 areas. Integration, and that's integration both within the health service and across health and wellbeing services, so across health and care. Information, so the provision of information, what's information about in terms of information, how you use and receive information, accessibility of information, but also about the data, the transparency issues, about how you get access to that crunchy stuff that can help you to inform and plan your services. The public's health, which is very much about the NHS's responsibility in public health, and workforce, which is the one I know least about, but it's about, within this whole new world, how do we support and create a workforce that is able to respond to an integrated service that delivers in different ways. That forum is currently in taking look. There will be an event near you. They're holding all sorts of round tables and discussion groups and things. So if you want to know more about that, there's more information on the Department of Health website. They will report end of November, December time, and their work will inform all policies that underpin those areas of work as we move forward. Future care and support, the Minister announced, I think, about 3 weeks ago, 2 weeks ago. I'm losing track of autumn, it's become a very stretchy period. We're working towards having a white paper on the future of care and support for April next year. That says spring. If you delve into lots of things, it's actually published in the reform programme as being April, so they're committed to doing it by April. That white paper will be informed by the Law Commission review and the Dillnut report on the future funding arrangements. And there's a whole tranche of work happening over the next 3 or 4 months to inform what's in there. Integration, again, is a key aspect to it, and they will work with and alongside the Future Forum, as is information, and again, they will work and work with the Future Forum on those aspects. If you want to know more about that, it's all on the DH website, or Natalie, who's with me today, or I can provide you with some contacts afterwards. We've had an awful lot of work in the past about what the future of care and support looks like. That's never really resulted in a white paper. It will this time, and it's really quite serious that we make sure that we get your views and your experiences fed into that, as being people who work with some of the most vulnerable people who use our care services. What does all that mean for the voluntary sector? Voluntary sector is not one homogeneous lump. You all do very different things. The projects you deliver are very different. Some of you are providers of public services. And as providers of public services, you will be tendering for services. You might end up being any qualified provider, so qualified to go on a framework where people can then choose to access your service because you provide that specific service. You might be providing a service for individuals, for somebody with a personal budget, and again you might therefore be on some sort of accredited list locally where people can choose different providers to meet different needs. You might be a provider or providing an element of an integrated service, so working in partnership with other service providers to provide a pathway or to provide an integrated package of care for people. You might be looking at partnerships and collaborations, including with foundation trusts. Foundation trusts have freedoms and flexibilities that other bits of the NHS don't have. You might be working in partnership with them around the care pathway. I used an example, and totally coincidentally, the man was in the audience, and this was when I was in Birmingham, so I need to be careful. But a foundation trust commissioning a care pathway around hospital discharge after hip operations. So the foundation trust wanted to make sure that people who had hip operations had good recoveries and didn't bounce back from really expensive physio and other forms of very expensive interventions. So they work with a local befriending project and a walking project, and they provide some resources to help all of that happen for those people who choose to use it. But you might also be an advocate or a voice organisation. You're not all providing a service. And I think this goes back to the tendering question that came up earlier, where actually we're often trying to get people to tender inappropriately because we're trying to tender for a service that actually isn't really a service and needs to be something that's grown and owned locally because that's how it's sustainable. And actually grants remain a perfectly usable form of passing money from one to another in order to make something happen. And I will wax lyrical with you about that later if you'd like. But involvement in JSNA and Health and Wellbeing Boards, you're not providing a service, but actually you're providing your expertise, your experience, and the information and the experience you have to inform that process. You might be helping to support the transition from LINKS to Health Watch. You might be trying to provide support to your emerging clinical commissioning group to ensure that hard to hear, hard to reach, or hard to engage communities are able to inform your CCG's commissioning intentions. The best example of that is I don't know very many CCGs that are very good at engaging gypsy and traveller communities, but I do know some very good gypsy and traveller organisations who can help GPs to have that dialogue with them. We've published it today, almost cheered when the Minister waved it. It's been a very slow birth, and Stephen at the back will know, as will Carol, as will various other people in the room who've been with us on a journey. It is meant to be a vision. We'd like to see people waving it around locally, saying, look, we should be doing this together. You should be valuing volunteering. We should be leaders together. We should be recognising the cost of volunteering and volunteering support in our local commissioning plans. we should be reflecting the fact that volunteering adds value across our services and our communities. It's not the sole domain of the voluntary sector, because actually the volunteering contribution in the NHS is enormous, but those NHS organisations often don't recognise the value that they have within themselves. And Carol Rawlins has joined us this morning from the National Association of Volunteer Service Managers, who are the people who support volunteers in the NHS, and I think often it becomes a conversation about the voluntary sector as opposed to a conversation about volunteering. So we're very pleased to have published this today. We think it's very timely because we want clinical commissioning groups, we want health and wellbeing boards to go, oh yeah, volunteers. We don't want volunteers to get lost in the transition process. So the volunteering vision, you've all got a copy of it, I hope. Essentially sets out a vision that has 4 components. It's about leadership, it's about partnership, it's about commissioning, and it's about great volunteer support. And I'm not going to try and teach my granny to suck eggs, because actually that's what you're all doing. So in conclusion, I've talked far too long, but voluntary organisations and volunteers are absolutely key partners in all aspects of our health and care services. We all need to think and work differently. So actually the services that we've been running for 10 or 15 years, we do need to put on our thinking hats and wonder if we can do it slightly differently, if we can do it in a more efficient way. There's new technology around that means that the way we did things 10 years ago, actually there's technological solutions that we might be able to learn about. Has anybody come across slivers of time? Time banking. Different ways of people accessing and using their time. I'm not a techie person, but they're quite exciting in terms of what they open up for people. So I think we should all be very open to these things and different ways of applying them and using them. We know that partnerships and collaboration are essential, and I don't know who it was that asked the question earlier, but the culture within a local area, within the Health and Wellbeing Board, within the NHS, is hugely important as to how open and receptive people are to working together. And those personal relationships are really important. And your evidence, and I'm sure you'll talk about this later, but your evidence of the impact and the outcomes you achieve for people are hugely important. Being able to quantify from the CAB perspective how much you have saved is a very powerful argument for being recommissioned, retendered, whatever language you want to use, for services in the future. Being able to demonstrate the quality and the impact of what you do on people's lives. It feels very onerous, but it's hugely important.